Welcome to this Tableau lesson where we will talk about Gantt charts. So first of all, we will deal with the department. So the first thing I would like you to do is we only want to filter the ER department of the hospital. So we will go drag department and drop it in the filter area, and I will just choose ER, apply, and OK. That would be the first thing first. So first thing, we filter the ER. Second, I will just focus on 2019. So again, I need to filter the date of admission to be only in the year 2019. So if we go by year, I'll just choose the year, apply, okay. Now I did two filters. The first one is ER, second one is 2019. The date of admission, we put it in the column. Date of admission, just write it down there. It shows me, of course, only 1 year because we just have it as a year. We could change it to, for example, day. So we have the day of the month here. Or we can just use it as exact date. You can see there is one called exact date that will give me the exact date we are talking about. So those are the exact dates. If you just move the cursor, you can see that those are the exact date. Of course, before I put anything in the rows, that will not help me that much. Okay, next what we will do is we will choose the doctor. This is the doctor. And also I would like to have the patient name. So each doctor has a name. I just want to see that the first doctor, which patient they have, and then we move on to the second doctor and all the patient they have. Of course, you can notice that this is the day of admission of that patient on that doctor. So Doc Ross have seen Alfred Barber in exactly this date. That's really nice. Now we can see kind of a dashboard when each patient has been admitted to which doctor at which exact date. What we want to do next is, of course, this is ER, and in ER, it's very important that the patient gets to the ER and then either he is discharged from the ER or has been admitted for other department in the hospital. So the waiting time between admission and discharge is very critical for the performance of the ER. Now, for example, the first one, Alexandra Wise, I would like to know how many days she spent in the hospital. I want to see it here on the dashboard that I know she admitted here, but when she has been getting out. Of course, you can just use patient ID instead of the exact name of the patient. That's fine. Okay. So for each patient, I want to know how many days he has been admitted. I don't have that information here. I don't have the number of dates in the hospital as attribute, as a column in my dataset. So the only way to do it is I have to do it myself. I have to introduce a new column called number of days. So how we do that? We go to click here, and then we choose create calculated field. Now I have to give this column a name, so maybe just say days in. So just the day in, how many days the patient was in. And how do I find it? Of course, we need to know the date of discharge. Do we have the date of discharge? Yes, we have the date of discharge. And we hope we can take the date of admission and we subtract them. Okay. And that's what we should expect to get. However, if we do that, imagine you subtract two dates. For example, April 29 minus March 30. You cannot expect what your answer will be. Do you want it in month? Do you want it in date? So this is not the best way to do this at all. How we will do it? We will just find something called date difference. This one. This is kind of a function. It takes many parameters, which are clearly in front of you now. It takes the date of admission, the date of discharge, and it takes how do you want the answer to be. I want it to be in these. Of course, I should start with the admission. I'm sorry, here. I should start with the admission here, and then go to the discharge. These, I'm sorry, it's not these, it should be just D. And now the calculation is valid, so I apply and OK. Now I have the number of days as one column, and it's already measured. So what we will do, I will move this one to the size because I want to see the size. Once we do that, we can see how beautiful our dashboard became. For example, without even moving the cursor, I know that this patient spent very few days here, but this patient spent so many days. He has been admitted for 52 days, this patient. Similarly, this patient is only 3 days, this one is 1. And here I can see the performance of the doctor in the ER, how severity is. There are some patients who spend only 1 day. Of course, the minimum is 1 day if we assume that this is just kind of admission and then discharge on the other date. This kind, we call it the Gantt chart, and it's very useful to see if we have a difference between things or there are.